what is ovarian cancer, and what are its manifestations?
Ovarian cancer is a cancer that affects the ovaries. This is the uterus. This is the womb that carries the baby, and lower down at its opening is the part we call the cervix. That's what develops cervical cancer. The ovaries is where the female egg is made, and there are two of them in the female body. So ovarian cancer is cancer that arises from these two organs in the body. They are small organs, almost double the size of a bean, I would say. And it starts as a small growth, then subsequently it can become a massive tumor that fills the entire abdomen. And it can spread very fast to the intestines, the liver, and even the lungs.
So in the event that a lady of reproductive age gets ovarian cancer, how do you have that conversation, and is it a possibility that you can harvest some of the eggs for future use?
For ovarian cancer, the difficult thing, it's not easy to make a diagnosis because it's inside the abdomen, and one cannot easily see until it becomes big. So these are patients who will come with abdominal swelling. They'll have a discomfort of the abdomen. They'll have their bowel function. They are not able to go for a long call as before. They have a lot of constipation. And these are patients who need to go and get checked. Now back to the question, are we able to harvest the eggs for younger ladies? Most cases, if it's a cancer of the ovaries, it's a bit difficult because most times you find both ovaries are involved. But there are some specific types which affect only one side of the ovary. And in these ones, then you are able to give hormonal preparations. You stimulate the normal ovary, and then you harvest the eggs and put them in a freezer. There is a special fridge that is used for that in the fertility centers.
And we have the facility?
We have the facilities.
Okay.
Then now you go in and operate and remove the uterus and remove the ovaries completely.
Can you just remove the ovaries alone, or you just have to remove the entire reproductive system?
You have to remove the entire the ovaries and the uterus.
Okay.
Because there is a high risk that these cancers are spreading to the uterus itself. The recommended treatment you remove plus the uterus. Now in future, this lady can use these eggs and get a surrogate mother. That is, she gets somebody else to carry the pregnancy for her. The fertilization is done in the lab. Then the fertilized egg is now put in somebody else's body in the uterus, and then the other lady will carry the pregnancy for her. That is being done very often, and we have the facilities in the
How
country.
young are you seeing the cases of ovarian cancer in Kenya?
Most of ovarian cancer is after 40, but there are some types we see as young as 18 years old.
Is there a particular reason why the numbers are growing today?
Well, there's better diagnosis, one. Lifestyle changes, what we eat, and a lot of pollution. Our rivers, our foods are so polluted. We use chemicals in our farms to grow our crops in the greenhouses. Possibly, the more we are consuming this, we are seeing more cases of cancer of the ovaries. For example, recently it was highlighted how the river is polluted, and actually we've seen people from that zone. We're seeing a lot of them coming up with various forms of cancer in the hospitals.
If you were to have 3 key messages to mothers, to sisters, to fathers who want to check on their daughters and husbands who want to check on their wives, for colleagues who also want to urge their female counterparts, what is your message?
1, vaccination. the HPV vaccine that is coming, and it's also affordable, it can be bought. At Kenyatta Hospital, it costs 2,000 a dose, and it's 3 doses. Vaccinate the young girls, all of them. The effects are insignificant, it is safe. Secondly is for screening. All women should go for screening, should go for the pap smears, or the visual inspection after applying the vinegar, the acetic acid we showed. That is a life changer. Just screening, breast examination every year. It will be life-saving. And even if one has anything that is not normal in the body, there's abnormal bleeding, go to hospital, get checked. If there's an abnormal swelling, go and get checked. If there's any persistent discomfort in the abdomen, please go and get checked.